India. With 1.12 billion people, is the second most populated country on Earth. Few nations have managed to preserve their ancient traditions while moving into the modern age any more than here.
You look out the window and you see people who perhaps are malnourished, living on the sides of the street in incredible poverty. And then you go to an area where there's some emerging affluence, or at least an entrance into the middle class, and you realize these people are all getting type 2 diabetes. I think we've seen throughout time that when a people is coming out of starvation, they view overweight and obesity as a sign of health and wealth.
That friction between what it has always been and what it has suddenly become is at the very root of the surge in type 2 diabetes.
There are fewer bikes. I mean, last time I was here, it was many, many more bicycles, and now there's mainly scooters and cars. So people aren't expending energy, and they're going to fall out of energy balance just like the rest of the world.
Energy balance is a simple, central concept to type 2 diabetes, no matter where you are in the globe. Simply put, it is calories in versus calories burned. Our bodies are genetically programmed to save up for times when food is harder to come by, a useful trait when we were hunters and gatherers. But in many places, the hunting and gathering has become somewhat easier and more predictable. The body saves and saves for those lean times that never come. As every doctor knows, obesity can lead to insulin resistance, which can lead to diabetes. Unfortunately, Indian culture is stacked against these facts.
People often blame globalization, and they say, oh, it's all those pizza shops which have come here, or it's something else which has come. Well, that may be true, because it's also fashionable to go. But you don't need to go to the Western joints to get bad food. You can get it right in our sweet shops. You can get it in all the fried foods. If you just stand on the street corners, you'll find everyone frying their food. And so the amount of fried and oily foods that are eaten are just too much. And it's a kind of culture.
To complicate matters, in India, the prevailing view of the obese body is not a negative one. It is, in fact, perceived as a sign of prosperity and good health.
So some of my colleagues have done this, where they've shown a picture of a lean person and a medium one and a really fat one. They may not pick the fattest one, but the obese one who's not morbidly obese, most people, if you show them these three pictures and say, who is the healthiest? They'll pick the middle or the other one. They'll say, this guy is sick. Why? Because usually a very thin person can be thin because he doesn't have enough to eat, is starving, malnourished, or has tuberculosis, or one of the other diseases.
Dr. Mohan knows the many complex facets of diabetes in India very well. It is his life's work.
This is a diabetes hospital exclusively for diabetes care. Dr. Franzen Kaufman, Dr. Kyle, kind of all under one roof diabetes care, so that anything that the patient needs in relation to diabetes we can offer under one roof.
Still get the blood pressure checks.
Better?
77. Prior to that, I was 85.
Oh, there you are, there you are, there you are.
Here, patients can receive diagnosis, treatment, proper food, and even the proper shoes.
Yeah, pretty.
Where? Some more designs? Yeah.
Shoes represent an area of struggle for the patient with diabetes that would be unheard of in many Western cultures. Bare feet are common, particularly in rural areas, and shoes are strictly forbidden in religious temples.
In some of these temples and other religious places and so on, it would be hot. You know, you can imagine Indian summer, how hot it would be, and the tile would be burning hot. And here's this poor fellow with diabetes walking barefoot, either because he walks barefoot or because he has to remove his footwear. And then by the time he walks up there, he's developed a scald. It's burnt, his foot. And that could be the start of a gangrene in somebody who has less blood circulation or has neuropathy and doesn't feel. So he doesn't, if you or I who had normal feet and we would run we wouldn't stand there. But this man is slowly going along because he doesn't feel the heat at all. So that could burn.
The old adage, an ounce of prevention is worth a pound of cure, is never more true than when addressing diabetes.
Hello. Hi, Dr. Kaufman. Hi.
This woman was brought here by her son in the hopes that something could be done for her gangrenous leg.
She's the one who had bullous, no? She had something like bullous diabeticorum with bullae on all the toes, and then two of them, so you can see the ones on top still have the bullae. Unfortunately, we don't de-roof these bullae quickly enough. They become gangrenous. You can still see the bullae there. Just kind of drying up, but this went into...
By the time a patient reaches this stage, the damage throughout the body is catastrophic.
And the blood circulation is good, and it's only gangrene, then you can just undergo a disarticulation and it's fine. But if the blood circulation is bad, if you simply disarticulate, it won't heal. So then we're stuck. Then the gangrene will spread further and further.
As the medical staff struggles to treat these disastrous symptoms, it's a clear reminder of how important it is to shift the struggle from treatment to stopping diabetes before it starts. But it's not always easy convincing people to make major lifestyle changes when they may feel perfectly healthy at the time. With no cure, the goal in any population is controlling the disease. That takes access to healthcare providers that many in the more rural parts of the country simply don't have.
Care is not available, it's not accessible because they can't actually go there, and it's not affordable. So we have to find different models. Before the big epidemic moves into the villages, we want to be there.
So Dr. Mohan and his colleagues have found a way to take the clinic to the people.
If we set up all the retinopathy and the nephropathy and the neuropathy screening in a particular place, to get people to come 100 miles to do that is very, very difficult.
Oh, I can imagine. I mean, there's so few vehicles you see here.
And they're all, they lose income. They may be working in a farm and they would lose a day's income. And here they can just come for an hour or two and get everything screened. And you saw
when Dr. Mohan's mobile unit arrives in a village, the contrast between the modern world and simple lives of the villagers couldn't be more stark.
And that's
this is a Doppler.
Here, patients can receive a battery of tests. And through satellite connections, the healthcare providers on site are able to send and receive data and images, as well as interact directly with doctors in the home
they
office.
can see us and we can see them. So.
How we are viewing here, it can be viewed through.
A little bit delay here. I'll just focus to Dr. Pradeepa. She wants to explain something on the patient.
Sugar nala unnu baadipilla enik pathadla kanla vandu damages silent.
Incredible, Mohan. This is, you know, I think worldwide this is the model.
Yeah.
And you transmit it.
Everything will be made.
This van, this project of bringing awareness, early detection, and effective treatment will only go so far. Mohan, his team, these people are going to have to figure out a way for the ultimate health promotion of changing cultural norm. What they eat, what they do, how they dress, what they put on their feet. That van will only go so far. They're going to, with their president and their people, figure out ways to live with what will now be a chronic disease.
Successfully fighting diabetes doesn't simply mean finding ways to adapt cultures to healthier habits. It also means finding culturally specific ways to work with the populations, because what works in one place may not work in another.